course, we know that you must be having interactions with your other colleagues who are commissioners for health, and by extension, maybe the Nigerian government. So we start on that premise. How ready are we to actually curtail the coronavirus in Nigeria? How prepared are we if, God forbid? So what is the situation and how prepared are we? How confident are you that Nigeria is safe of coronavirus?
Thank you very much for that question. As you know, coronavirus is a disease that you cannot actually stop because it's viral. However, you can control it. And as for Nigeria, what we are trying to do is man our borders, including actually preventing flights from the affected areas from landing in our airports. We also have a screening program of using laser screens to screen people who arrive to ensure that they don't have temperature. When people are identified, there is a quarantine area which is held in Lagos, which is the major airport into the country, and people are quarantined. Also, nationals of the Chinese community, they've been advised to self-quarantine in their own properties for 14 days. As you know, it takes 2 to 14 days for the incubation period for coronavirus. So those are the steps that have been made. Isolation centers for people who may actually be diagnosed, they're around the country, including with us in Ogun State. We have an isolation center in OUTH, which we're upgrading so that should in case we do have a case, the staff are trained and we have a place to hold the patients. That's what we've done so far.
Okay, from the expert's point of view, we need some education here too. What are the causes? Even from where it broke out in Asia, what were the causes?
As you know, coronavirus is a group of viruses. It's a virus that you find in animals, including rats and snakes and bats. And the suggestion is this particular strain is found in bats and possibly Wuhan, where it originated for. They think that there might have been handling of fresh meat with animals, and that's where it originated from. It's uncommon for it to occur in human beings, but through that transmission, somehow it may have muted and hence be able to infect human beings. That's why it's been slow for the Chinese to actually respond, because it's not commonly found in human beings.
And we were dealing with Lassa fever before the arrival of coronavirus.
Yeah.
And with the symptoms, we see that there are similarities between the symptoms. Can you tell us the differences, the similarities, and how to detect that it is actually coronavirus?
Yeah. Both of them would have febrile illnesses. They could have sneezing or coughing. The more important thing with coronavirus is that you have a chest difficulty breathing. It's more like an upper respiratory tract infection, shortness of breath. That would point more to coronavirus. With Lassa fever, it's more a hemorrhagic fever, which means blood bleeding, bloody urine, bleeding from your nose, passing bloody stool. So that is the major difference in the presentation.
Okay, so how do we prevent now? We know that they both are transmitted from animals, and we eat those animals, especially in Africa.
For those we eat.
Yeah.
The thing is, actually, with Lassa fever, you actually do not, there's some people that eat the rodents. Most times, the Lassa fever is transmitted from the urine and feces of rats, from the way we process our food, like the cassava for Gary. Is spread on the road, and the rodents, run over it, and we don't know. And even most people don't cover their food, so when rats run around, they have an opportunity to pee. That's how Lassa fever is transmitted. So what you need to do is cover your food and cook it, cook your gari rather than drink it, especially in this dry season where Lassa fever is commonest. Once it becomes rainy season, the risk of Lassa fever actually decreases. With coronavirus, the prevention is actually, using both of them actually, any viral infection, washing your hands with soap and water frequently, and using where there's no, excuse me,
Sorry?
where there's no soap and water, you can use sanitizer. So it's quite, instructive. You could have a personal sanitizer in your pocket. There's a pocket one that you could hold in your handbag. And when you shake people, be aware, to sanitize your hands or even avoid close contact, hugging, kissing, avoid congregational areas, sort of markets, churches sometimes, parties. But I would not say that at this point because we do not have coronavirus. So there is no need to not go to churches, but you can limit the close contact like hugging and kissing. Because with coronavirus, you have to be within 6 feet of a person to contact it. And it's through droplets, from sneezing. When it touches your nose or mouth from sneezing, they haven't been able, spit. And they haven't been able to show that if you touch someone, like shaking, that coronavirus could be transmitted. But to be cautious, you actually, those close contacts you could avoid in someone who's febrile and unwell. But the important thing is actually to tell people that we should not be scared. We should just practice, safe personal hygiene. People who have coughs should cough into their elbow like this rather than their hands because you could still transmit it if it's in your hand. If you do use your tissue or handkerchief, dispose of it in a safe way and not leave it around. And anyone that actually has any symptoms of fever or difficulty breathing, they should go to the nearest health facility, preferably a government health facility, to seek help, because our health workers have been sensitized to identify at-risk people. And we have distributed information, education, and counseling materials to actually support our health workers. We're working also with the immigration services to give us a list of foreign nationals that are within our borders, especially in Ogun State, so that we know their movement within the Ogun State. And we've had meetings with particularly the Chinese community to know how many of them are out of the country, where they are outside the country. And they've put things in place as to notifying us if at all they're coming back. And a few of the companies have actually told their personnel not to come back at all.
For now.
So for now. So, and also they've identified isolation centers, in their own companies where their staff will be isolated for 14 days, even when they come back, and monitored, given personal thermometers to be monitored. They have health personnel that they've appointed to monitor their staff. We have their contacts, they have our contacts. We're working with them to develop posters that are interpreted into Chinese, because we have to protect the local workers that work with them, and we have responsibility even for the Chinese community within our society. So it's a two-way thing, and we are working collaboratively to achieve this.
Okay.
Honorable Commissioner, in this time of protection or overprotection, there's nothing we cannot do just to prevent it. Should we be wary of edibles too, especially? Edibles coming from that side, Asia? You are a professional.
There's no evidence that this is transmitted by consumption.
Okay.
And my advice is whatever food you're eating, wherever the source, you should cook it properly at this point in time. Especially with Lassa fever, you need to cook your food. I wouldn't worry about edibles. We also need to be actually aware of Nigerian nationals that have traveled out. It's easy to identify foreign nationals.
Foreigners, Especially
But there are lots of us that travel to China,
yeah, sure.
and there are no direct flights from China into Nigeria that I know of. So they would transit through one country or the other. So the people, I would advise anyone, any Nigerian citizen that has been to China, to actually make themselves known to the Lagos State. We're working with the Lagos State government, because Ministry of Health, because they are the port of entry. And they should make themselves known when they return into the country to the Lagos State Ministry of Health, the epidemiologist in Lagos State, so that we can support them, because we do know that any viral illness, if picked up early, there are antivirals that can be used. It's not fatality for every person infected. The outcome, the prognosis usually depends on the diagnosis to treatment time lag.
So we want to ask you this. We know coronavirus, the source is China, majorly China.
Yeah.
And people are wary of going to China now, or the government is trying to gatekeep people coming in to prevent this. Are they winning the war in China? Because if the war is won over there, then we can be rest assured that our country, Nigeria, is safe. Is the war being won there?
I believe the Chinese government is doing their best to deal with a situation that is really a global crisis. They've done a lot, as you see on the news. They've put up 2 massive hospitals within 2 weeks. And from the reports on Wednesday, the rate of diagnosis is slowing down, although the fatality was highest, but the rate of infection is slowing down.
Okay.
To me, that means that we are winning the war, and we're all hoping that soon we'll hear that it is actually dwindling into an insignificant level in a controlled manner.
You were talking about prevention the other time, and one way you said we should wash our hands regularly. And we know that there are methods of washing this hand. Can you let us in on how to wash the hand properly? Because we know that sometimes you'll just put water in the bowl, use your soap right there in the bowl and wash your hands. Is that the proper way?
No, if you're washing your hand, you shouldn't wash your hand within, it should be running water. Apply your soap and ensuring, most of us wash our hands this way, but you have to ensure that you wash the center of your hands as well, and the fingers, round your fingers, because those areas we don't tend to pay attention to, because when you actually screen, you find that people have missed out the center of their palms.
All right, let's, well, you said Ogun State is prepared in case of, you must be prepared always, just like the motto of Boy Scout, be prepared. And of course, you've said that you had interactions with these Chinese people, and of course you know some of them. But what about in case in case of anything, do you have some helpline that are available for prompt reports of any case?
We do have a number for our epidemiologists, because this is a public health issue, so it's the epidemiologist that deals with this. And the number will be shown on the screen at the end, because I don't have it on me at the moment, but it will be shown on the screen at the end. The other group of people that we have to be conscious about is the market women and motor parks as well. Market women and motor parks, because those are congregational areas. So we are targeting those group of people to actually address them. We're going into our schools to teach our children with the information and education and counseling materials, to teach our children on how to maintain good personal hygiene during this outbreak.
Okay, let's look at the case of Lassa fever now. When there is a victim or an occurrence, what should be the first thing to do?
If it's Lassa fever, if you see anyone with a fever that's not responding and they've got a bloody discharge from their nose or blood in their urine or passing stool, the first thing is to take them to the nearest government hospital, not a private hospital, a government hospital, because the staff in the government hospital have been trained on how to identify at-risk people. In each health facility, there's a holding area where the individual will be held until the diagnosis is confirmed. The state epidemiologist is usually contacted when there is a suspicion, and the state epidemiologist attends and takes some blood samples to test for the virus. This result usually is available within hours, and on the point of diagnosis, the individual is then managed with by our staff wearing personal protective equipment, which is a mask, goggle, specially made gowns, which to avoid transmission. And they're now transported to the isolation unit.
What was the reported, and what's the situation now? What's the latest on the reported case, the only reported case of Lassa fever in Ogun State?
The only reported case, as you know, was a pregnant woman that was actually transferred to the National Treatment Center in Edo, Erua. And she was discharged yesterday with a baby. The baby is negative. She's now negative. They're alive and well. And by the grace of God, we haven't diagnosed any other case within Ogun State, and we hope to keep it that way. And that is due to the sensitivity of the people and the response to the training that we've given people. So we're very grateful to the public.
So obviously you are happy with the response of the people from, the instructions you give on how to prevent it, and of course we want to say Ogun State people are also health conscious.
Absolutely.
And that's why we are where we are today.
Absolutely.
Now, I think each charity has the helplines now.
Yes, we have the helplines in case you need help. And on the Lassa case, fever in Nigeria, you want help from the Ministry of Health, you have to call 081-88-97-8392. Let me take that again. 081-88-97-8392. And the second line is 081-88-97-8393. That's are the help lines. In case you notice anything in your community, you call those lines, and our own Ministry of Health will swing into action. And it will be
Honorable Commissioner, beyond coronavirus, beyond Lassa fever, we have our own challenges too. We want to keep it up there as far as health is concerned in Ogun State. So, especially the primary health care, how will you describe the situation now since you came on board as the Commissioner for Health?
Thank you very much for that question. With regards to the primary health care, the vision of the Excellency, Prince Dapo Abiodun, is that we have a functioning and accessible primary health care in every ward across Ogun State. So that is 237 wards, and that is our aim. We are starting, as I speak, to start renovating about 21 in each local government. And it's going to be a phased project where we will take 20 at each time and try and renovate them, upgrade the equipment, and hopefully adequately staff them so that any citizen of Ogun State is within a walking distance or a 5-minute drive from a functioning primary healthcare service. We're also procuring IT support that would make this service electronic. In order to make it affordable to the people of Ogun State, there is also the Ogun State Health Insurance Scheme that would hopefully be launched later on this year, that would help the citizens to be able to access good health at every given time without being out of pocket.
Are you under pressure?
I don't think so. I think we're in control of this. We're not under pressure. The good part is that...
Looking at what you've met on ground.
Oh,
as the
okay.
Commissioner, yeah. Are you under pressure?
Well, there is need to improve a lot of the facilities. Over 50% of the facilities are actually in dilapidated state. The functioning ones are not adequately staffed. So I wouldn't say we're under pressure, but we met a challenge which I think is surmountable.
So what is the time frame of this new project you want to embark on?
As I said, 236 units. So we are starting with the first 20. And by the grace of God, it should be ready, the first 20 should be ready before the end of May.
Well, thank you very much, Honorable Commissioner for Health in Ogun State, Dr. Tomi Koka. And of course, on the entourage of the Honorable Commissioner here, we also have in-house, somewhere, watching and nodding, is the SSA to the Governor on Health, Dr. Ololade Kehinde. We have the Permanent Secretary, Ministry of Health, Dr. Ekundayo Adesoya Ainde. We also have the Director of Administration, DAS and Supplies, Ministry of Health, Mr. Oluwasomi, and of course, Director of Public Health, Dr. Festus Shoyinka. Of course, they are a solid team that the Honorable Commissioner of Health have been working with. So once again, I want to thank you very much.
Thank you very much for having me.
Except you want to leave a parting shot as we allow you go to the people of Ogun State when it comes to health issues. Your parting shot will be what?
I would say it's important for you to access the affordable and accessible healthcare that His Excellency Prince Dapo Abiodun is providing for you. And I look forward to seeing the health of Ogun State people improve. Thank you.
And on your behalf, I want to say, Lassa fever, coronavirus, relax. No cause for alarm. Am I right?
Yeah, we'll say we are safe.
All right, thank you very much for what Honorable Commissioner. We'll take this break. We'll be back. A whole lot of people still coming on air very, very soon. It's the Wednesday edition of Newdawn on OGTV.